Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. We perform a lot of blood tests for women who have syndromes like PCOS or PCOD, and a lot of them ask us how can they confirm whether they really have PCOS. There's a lot of misinformation about PCOS, what it means, whether the diagnosis is done just on the basis of your symptoms or whether the lab tests actually help to confirm it. And I'm making this video just for this purpose. So as per the medical norms, you need to have at least two of these three things to say that you have PCOS, which I've listed on this page. The first and one of the most important things is there should be an elevated or an increased level of male hormones in your blood. Now, normally in a woman's blood, the male hormones, which are things like testosterone, are present in very low amounts. They are present, but they're present in very low amounts. But when you have PCOS, their amount increases, and it increases to a point where we can detect it on lab tests, which is basically the testosterone blood test, which measures the level of testosterone in your blood. So one of the things that you should have to say that you have PCOS is that the level of this testosterone should be above normal. The next thing is that you should have what we call cysts in your ovaries. Now, your ovaries are two organs which are present somewhere below your stomach. You have two of them, one on either side, and their job is to release the eggs during your cycle. The ovaries normally have a small little spaces or boils in them. You can call them boils, is an easy way to understand. A small little spaces. But if you have a large number of these spaces and if they are beyond a certain size, that's another criteria to say that you have PCOS. Now, the only way to find this is by doing an ultrasound scan or a sonography, which you may or may not have had at some point in your life, and that's how your sonologist will tell you in your report whether these cysts are present, how many of them are there, and what is their size. And there is a cutoff for that. If you go above the cutoff, that's another piece of evidence in favor of PCOS. And the last thing which you should also have are definite problems with the regularity of your cycles or your periods. If your periods are irregular, if you have missed at least some of your periods, those two things are proof that there is something wrong with the control of your menstrual cycle, and that is another criteria or evidence in favor of PCOS. So as per the norms, you need to have any two of these three, and then we can say that you definitely have PCOS. Thank you.